Take one.
I think the instigators were really Annie Woganot, Barb Yondorf, and Marcy Morrison.
The project officer in charge of healthcare at the Rose Community Foundation was Annie Woganot, and I was a consultant, but she and I had worked together on a number of projects. It was sort of a joining of the minds about both of us from different perspectives, the foundation and me as a consultant saying there's some missing things in the community and what can we do about it.
The idea was we should have some kind of an institution that everybody could trust, that had credibility, that could, be the source of information, and then could help us understand what that meant and what there was to be done about it.
We talked to our board at Rose Community Foundation, and they said, this is interesting. Why don't you see if people are interested, if there is an interest, if we're the only one interested, who else is interested? And we got in touch with the Caring for Colorado that was recently formed, and they were interested in doing the feasibility study with us. So that's how it began.
I arrived in October of 2000, and our board had just received the feasibility study result that Barb Yondorf had done. And prior to my time, our board had had some similar conversations. So our board was really enthusiastic, and as they read the report, the board decided we should pursue it one step further. So that's when I had a conversation with Sheila, and we decided that it was only appropriate to ask the Colorado Trust, the other major health foundation at the time, if they were having similar thoughts and if they were interested. So I then made contact with John. I guess we both made contact with John, and then he came to the table.
One take I had on it and why I thought it really had a lot of importance was that the three of us had often been reminded that our role in this community was to collaborate, and it was easy to say but hard to do, and this seemed like a perfect opportunity.
So we were very pleased when we hired Pam Haynes.
It was a vision that was very consistent with my own values and my own desire to influence policy in a positive way that didn't include spin, but really was based on evidence. And so actualizing the vision of the three foundations was real easy for me to do because I shared it.
I've been at CHI for 7.5 years.
And I have been at CHI for 7.5 years as well. In fact, I think I beat Amy by a week, starting back in 2005. I think one of the most gratifying things for me is to talk to our constituents. I get a lot of requests for information and requests to get connected up with different types of resources. And for me, talking to people and hearing how we assisted them in getting connected to data or resources is one of the most fulfilling things.
There are no preconceived answers to the questions that we're trying to answer. We're using evidence and analysis, and there's a lot of intellectual freedom in that.
You can't solve any problem, and especially any healthcare problem, without having the adequate data to tell you what is the essence of that problem and what is the magnitude of that problem. And the Colorado Health Institute has been able to find a way to gather all the necessary data. They not only gather it, but they create, as I said, information that's valuable, that's readable to the stakeholders.
One of the other things that CHI has done that I think is a tremendous asset to our community is that role of convener. For example, through the Safety Net Advisory Council and those labs that they conduct, we're able to gather together and talk about some of the information that's been collected and dialogue about what it really means. It provides not only the picture of what's going on in our immediate community, which is for us is here in Denver, but it also gives a reflection of the whole state. And so we can kind of see how we fit and place and how we even collaborate and cooperate and complement what's going on throughout the state of Colorado.
When I first got down here 5-6 years ago, I was obviously a freshman, didn't really understand things down here very well, and I probably looked at CHI a little bit skeptically. But over the years, I have grown to believe they're a reliable source of generally nonpartisan information.
I think the most important thing that CHI brings is a level of objectivity, the talent of the staff, the way they ask questions, the way they help you think through a problem, help you think about how to ask the right questions, how to evaluate what you're doing, to know what you're doing is making a difference. It's a great organization, and I don't think we could have accomplished what we've done in Colorado in the past 10 years without them.
CHI provides the Colorado Coalition for the Medically Underserved a valuable resource in the data and the analysis that they provide to the public. And it enables us to do innovative things, to look at innovative questions, and to really guide our mission, guide our efforts toward our mission in a very impactful way.
We at the Colorado Trust look at the Colorado Health Institute as an essential public service. The Health Institute provides that balanced approach to data analyses and turning data into information that is essential for policymakers to make the best decisions. And even though they want the data, their willingness to actually pay for the analysis is severely restricted. So that we at the Trust feel that not only does CHI provide us with the analyses and information that we need in order to support our mission, our vision, and our grants, but we also think this public service is essential. So we feel we need to step up to the table and make sure that utility is available.
CHI can play a very, very strong organizing element with their data and their ability to facilitate as an objective, almost the honest broker type approach to achieving collective impact in the area of health and healthcare. I think it's a very, very valuable role that they're already starting with some of their work with Civic and COREO and other organizations. And I only see that getting stronger.
CHI will broaden the focus in the next 10 years, moving from healthcare delivery to looking at determinants of health. That's one of the strategies that we have moving forward. The second is to really build on the foundation of data and analytics that we have and have built over the last 10 years. We want that data to inform and provide perspective and expertise on the issues of the day that we're confronting here in Colorado.
CHI is finding a way to be proactive in a very rapidly changing environment. And with the skill sets we have here, I believe we're ready to take on the new challenges of a transformed healthcare system and the new challenges of a demographically changing environment where there's an aging population and we have much different needs than we may have had just even a few short years ago.
So what's brand new, we just launched a website in May of this year, and our website is kind of us moving forward in this new space where we, instead of just being a clearinghouse for data, we've really moved to meeting our constituents halfway. So we really want to put context to the data so we can meet the people who are looking for it, like our partners in the community. Maybe they're not really into reading all the numbers in an Excel sheet, but we would love to give them a fact sheet that they can read simply and easily and really work with them that way.
Part of our partnership allows us to really be dialed into and understanding and responsive to community needs. So we can be, as Tasia had mentioned, really trying to forecast what people might be needing, but also responding to their needs in a timely way.
One of the ways that we're working on improving our timeliness is through our social media efforts. So in addition to a CHI Facebook page and a CHI Twitter page, we've launched a professional Twitter pilot where we have content experts such as Sarah who are participating in Twitter and social media and engaging in their own communities through those platforms.
I am Amy Downs, and I am CHI.
I am Jeff Bontrager, and I am CHI.
I am Kathy Helm, and I am CHI.
I am Rebecca Kreppen, and I am CHI.
I'm Tim Dunbar, and I am CHI.
I'm Tasia Sin, and I'm CHI.
I am Natalie Triedman, and I am CHI.
I'm Brian Clark, and I am CHI.
I am Emily King, and I am CHI.
I'm Deb Gokin, and I'm CHI.
I am Wes Morey, and I am CHI.
I am Sarah Schmidt, and I am CHI.
I am Anna Vigran, and I am CHI.
I am Megan Lane, and I am CHI.
I am Michelle Leake, and I am CHI. And what you've just seen is all of CHI. We are an organization that was funded by the community, and we are an organization for the community. we're celebrating our 10th anniversary with the release of a photo essay called Colorado, A Picture of Health. And what we've tried to do is capture the images of Coloradans who are really on the front lines of healthcare, and they remind us of those whom we ultimately serve. Health is everywhere, and we've traveled across the state focusing our lens on those who are most affected, most impacted by the policies and decisions made at the state and local level. So we've focused on children, the elderly, the frail, really the most vulnerable among us. This book shows the significant strides made in Colorado over the last 10 years, but it also paints a picture of how much more we have to do. With these stories in mind, we here at CHI look forward to serving the Colorado community over the next 10 years.